Let's talk about the things which you are allowed to put inside the vagina. So I have made other videos whereby I have explained about the things which you should never put inside the vagina. And some people asked me that I should make a video whereby I talk about the things which are allowed to be put inside the vagina. So these are the only things which are allowed to be placed inside the vagina. So I'm going to give you a list of things which you can put inside the vagina and the reasons why the things are allowed to be put inside the vagina. So welcome to my channel. For those who are new to my channel, my name is Maxwell Aguirre, and in this channel I discuss different health related topics. So if you have not subscribed to my channel, please consider subscribing. And also I want to remind you to please put a like in the video, and also don't forget to put a comment down in the comment section below. I want to hear your thoughts, and also if you have any questions or you have any suggestions on the things which I should discuss, you can put them down in the comment section below. So welcome and to my channel. Like, share, subscribe, and let's go to the video of today.
I be so sick of you niggas, y'all contradicting. I be so bored myself when you come and fuck me. I feel so ordinary, except when you around me. Treat me like corduroy, you wear me out. Arguments, you tear me out. Tripping about you.
Okay, welcome again. So the first things which are allowed to be placed inside the vagina are contraceptive devices or family planning devices. So these are devices which are used to prevent unwanted pregnancies. So these devices include the condoms. We have the male condom and we have the female condoms. So the male condom is worn on the penis, while the female condom is worn inside the vagina. So the female condom has two diaphragms, whereby it has the larger diaphragm and the smaller diaphragm. So the smaller diaphragm is the one that is required to be inserted inside the vagina. The other contraceptive device which can be placed inside the vagina is the cervical cap. There's something we call the cervical cap. This is a device which is placed inside the vagina so that it prevents the semen or sperm from moving from the vagina during sex and traveling to the cervix, which might go to the uterus and make you become pregnant. We also have cervical sponges. Yes, we have cervical sponges. These are also contraceptive mechanisms whereby they are placed inside the vagina, deep inside the vagina towards the cervix. So these sponges absorb the semen. They absorb the semen and the sperms, which have been released during ejaculation. So after sex, the cervical caps and the cervical sponges should be removed after sex. We also have the intrauterine contraceptive device, the IUCD. Some people call it the IUD. It is the same thing. So this one is placed in deep inside the uterus. It is a T-shaped device. Some are hormonal and some are not hormonal. And this is the safest mode of contraception. The safest means of family planning. So this, in the process of inserting the IUCD or the IUD inside the body, it needs to pass through the vagina. So those contraceptive devices are one of the things which are allowed to be placed inside the vagina. But the second thing which can be put inside the vagina is the water-based lubricants. We have different varieties of lubricants. We have the water-based lubricants and we have the oil-based lubricants. We have the silicone-based lubricants. But the only lubricants which you can use which is the best to be used is the water-based lubricants. This is because the water-based lubricants can easily be washed away from the body. When you use the oil-based lubricants, you'll find that the oil will tend to smear on the walls of the vagina, and this oil does not come out easily. So it traps some bacteria, creating an environment which has low concentration of oxygen, and we say that there are some bacteria which enjoy the low concentration of oxygen, which we call them anaerobes, and these bacteria can cause urinary tract infections. So there are different circumstances in a woman's life whereby you might find that at one point of your life you are experiencing poor lubrication. And one of the circumstances during menopause, or in circumstances such as we call them the perimenopause. Perimenopause is whereby you experience the signs and symptoms of menopause while you have not yet reached the age of experiencing menopause. So you find during the perimenopause and during the menopause, there's a low production of the estrogen hormone. And I say that the estrogen is the hormone that maintains the elasticity and the lubrication of the vagina. So under these circumstances whereby we have low estrogen hormone, we'll find that you'll have problems with lubrication. So you are allowed to to use the water-based lubricant. So sometimes the doctor might prescribe you to use an oil-based lubricant. So the oil-based lubricant should only be used under prescription. The other thing which can be placed inside the vagina is during vaginal examination. These are the vaginal examination devices. So we have two types of vaginal examination. We have the digital examination and we have the speculum examination. The digital examination is an examination whereby the doctors or the nurses uses their fingers to examine your vagina and your cervix. So it is mainly used during deliveries. If the nurses or the midwife wants to know if your cervix has started to open, they will have to use their fingers so that they can assess the opening of the cervix. Also, it is used to monitor the progress of labor because there's a way they can measure the size of the dilatation of the cervix using the finger. So it is an important examination because it helps them to know the time and the progress of your labor when you are undergoing the normal vaginal delivery. So the other type of the vaginal examination, sorry for that. The other type of vaginal examination is the speculum examination. A speculum is a device which is placed in the vagina so that you can help in the opening of the vagina so that they can visualize the vagina and the cervix. So this is an examination which is used to assess the condition of the vagina. This is used by gynecologists or by medical professionals, whereby they assess the condition of the vagina. So this can be done in situations such as when you are having abnormal vaginal bleeding. When you are doing a procedure, we call it the pap smear, which is a cervical screening procedure. So under these circumstances, you'll find that you are allowed to the vaginal examination devices are allowed to be used inside your vagina because they use procedures whereby they minimize the entrance of bacteria and viruses and things that might cause urinary tract diseases inside your vagina. And the number four thing which is allowed inside the vagina is the vaginal suppositories, or we call them the vaginal medications. So these are medication which include the antibacterial medication or antifungal medications, which the doctor will prescribe to you and tell you that to go and put it inside the vagina. So it comes in form of rings, tablets, or the rings and tablets. So which the doctor will tell you that you go and put it inside the vagina. So you should only use medication which have been prescribed to be used inside the vagina. Use only medication which the doctor has told you that this one can be put inside the vagina. Don't go to the shop and buy to the chemist and buy a medication and put it inside the vagina. Only use vaginal medication under prescription. And also when using this medication, there's something called the applicator. Use the applicator when inserting the vaginal medications. Do not use your fingers to insert the vaginal medication. The other thing which can be allowed inside the vagina, not inside the vagina, on the vagina, is the hygienic pads. So these are pads which are used by women when they are on their days of menstruation. So you place them on the vulva, not inside the vagina. The vulva is the outside part of the vagina, so that the hygienic pads can collect the menstruation blood. We say that you should not use the tampons because tampons will be introducing infections inside your vagina, and also there are a lot of risks which are associated with the use of tampons. So you can use the hygienic pads to collect the menstruation blood. The other thing which is also on the list, the other thing on the list is also the baby. So the vagina is also called the birth canal. So that is the place whereby the baby can come out from the womb, from the uterus, outside the body. It is a passage that allows the baby to come out from the uterus because it is the only opening towards the uterus, and it is a purpose which it was created for. So during the normal delivery, during the normal vaginal delivery, the vagina is the organ which is used to allow the baby to come out of the uterus. Lastly on the list, we have the penis. So once in a while, the penis is also a natural thing which is allowed to be put inside the vagina. But because it is allowed inside the vagina, should not mean that you should just allow it anyhowly. You should be careful about contracting urinary tract infections and also sexually transmitted diseases. Also be on the notice of getting unwanted pregnancies. Use the contraceptive devices. Use family planning methods so that you can prevent yourself from getting unwanted pregnancies. And you should know that the condom is the only thing that prevents you from getting unwanted pregnancy, and also prevents you from getting sexually transmitted diseases. So with that said, I've come to the end of my video whereby I've talked about the things which you are allowed to put inside the vagina. So if you have not liked the video, or if you have not subscribed to my channel, please consider liking the video. Also consider subscribing to my video, because when you do not subscribe, there's a lot of things which you might end up missing, because I'm here to share more and more videos on health related topics. So with that said, I just want to thank you for sticking to the end, and I want to thank you for being my loyal fan. So with that said, let's meet in another video. Remember to subscribe, to like, and let me hear your thoughts in the comment section below. So with that said, bye bye, and let's meet in another video.